This video is to assist you with the interpretation of your results for patients using the Dutch testing model that are taking estrogens transdermally or on their skin in predominantly a cream. So just as a reminder, as we look at these results on page 2 of the report, the results when they come between these two stars find themselves in the premenopausal range, whereas the little purple band at the bottom there represents the postmenopausal range. So as we look at a patient like this, we'll see that if she's on transdermal estrogen, still her results are really down in the postmenopausal range, so probably doesn't represent much of an increase, if any, above baseline. But when you're taking hormones transdermally, you don't tend to get as much of an increase in urine, and it's true of serum as well, as you might expect. And you can even see some symptom relief in some cases when the results have not yet begun to rise, which tells you that urine testing may be and saliva testing is helpful in confirming this, that it may be a bit of an underestimation of what's going on systemically when you're taking the hormones transdermally. So we've got to be careful with the absolute levels and the dosing. But what we can confidently use this for is to evaluate the metabolism. So with the metabolism, we use the pie charts for phase 1, and we'll talk about methylation a little bit later. But what we look at is what's normal. What's normal is about 70% of the metabolites down this 2-hydroxy, which is the more protective pathway, 10% down the 4-hydroxy pathway, and 20% down the 16-hydroxy pathway. So with a patient like this, you can see that the 2-hydroxys are over 80%. So there's an overproduction of the 2-hydroxy and a little bit of an overproduction also of the 4-hydroxy, which is one you do not want to see predominate. And then the 16-hydroxy, you can see it's very low there, is underrepresented in this case. So we can look at the metabolism in spite of this issue with transdermal estrogens. So if we see a woman like this who's on transdermal estrogens, where you can see for estradiol the postmenopausal range is here, and this patient finds themselves above the postmenopausal range but below the premenopausal range. So that does likely represent, and you can definitely see it for estriol, an increase above the baseline, but not yet up into the premenopausal range. And again, if the urine testing is to a degree an underestimation, it may be wise to be cautious of pushing those levels way up into the premenopausal range. Now, it is possible to get levels that look like this, where you're just high across the board using transdermal estrogens, even though the levels seem to lag behind the clinical effect just a little bit. So if you are using large doses of 5 and 10 milligrams of estradiol, you will push those results, quite high. So you can use it to evaluate dosing to a point, but it is important to understand it more completely when you're doing that, and to follow, I think, the symptom profile very closely. And again, you may want to watch our longer video on that topic. As we mentioned, we want to look at the levels, we want to look at phase 1, and then we want to look at phase 2 to see how methylation looks. So in this particular example, this is 2 different patients. So you can see their 2-hydroxy, which is a phase 1 product. They're about the same. And then we're making a phase 2 product, this methylated product, from those. And we can see that those two, for these patients, are very different. So when we look at the ratio of them compared to what's expected, the top patient shows high methylation activity. The patient on the bottom shows low methylation activity, and that's important to look at as well. Now, when you're on low-dose transdermal estrogens, do keep in mind that as these values get down around the detection limits, so maybe 0.3, somewhere in there, these ratios of hormones are going to be more approximate as you approach the detection limits of the assay. So we don't want to, with especially topical creams, chase the lab values as much as you would typically do in other scenarios where the values are more intuitive and follow more closely the symptom picture. So again, urine may be a bit of an underestimation of at least what some tissue may be getting in terms of the hormone levels. Symptom relief sometimes begins at lower doses than that at which the urine levels increase above baseline. And do also keep in mind, and this is important, especially with some of the pharmaceutical products like estrogel and some of these, alcoholic gels may increase levels much more than creams, and you'll get levels up and into the premenopausal range at doses where if you use a cream, you don't see that. So, and again, there's another video for topical hormones that's more generic that really goes into the details of saliva and serum and urine and a lot of clinical studies to really help you understand this video. But at the end of the day, it's difficult to dose topical hormones with lab values, and you need to understand that as you're trying to put the lab values in these scenarios into their proper context to treat your patients optimally.